Good morning. My name is Krista Wilk. I am a research assistant in the Center for Research and Education at the Benjamin Rose Institute on Aging, and I'm the Dementia Inclusive Community Project Coordinator on the Administration for Community Living funded project, Expansion of Dementia-Capable Communities within Urban and Rural Settings in Ohio using evidence-based and informed programming. Thank you for joining us today for Behavioral Interventions when caring for someone with dementia. This webinar is presented and supported as part of this Administration for Community Living project and was developed by Memory Lane Care Services and the Ohio Council for Cognitive Health as part of another Administration for Community Living funded Alzheimer's Disease Programs Initiative project in Northwest Ohio. We are very fortunate to be working with these partners to offer this webinar 3 times throughout the course of our project. Today's webinar will be recorded. During the webinar, you may submit a question at any time using the Q&A button at the bottom of your screen. We have staff monitoring the questions in the chat to convey your questions to our presenters and to answer any technical questions you may have. You can turn on captions by selecting Live Transcript, which is the button with 2 C's at the bottom of your screen. We are conducting an evaluation for our dementia education sessions as part of this project. You should have received an email with a link to a pre-session evaluation questionnaire, which also contains further information about the evaluation. If you did not have a chance to complete the pre-session questionnaire, we ask that you please complete this now using the link provided in the chat. By doing so, you are helping others in your community. Your responses and feedback will be used to show the impact of programs like these to improve the tools and resources provided to individuals with dementia and people who support them. I now have the pleasure of introducing our speakers for this morning's presentation. Lindy Winsler is a social worker at Memory Lane Care Services. She is a care consultant who works with caregivers and individuals with dementia to help them through decision-making, struggles with day-to-day challenges, and planning for the future. In her current role, she is primarily responsible for supporting successful execution of the ACL Northwest Ohio Dementia-Capable Grant and offering the evidence-based BRI care consultation program. Jennifer Wolf is a provider training coordinator for the Lucas County Board of Developmental Disabilities. Jennifer has extensive experience in behavioral support, mental health, and trauma-informed care in a variety of settings and with diverse populations. Jennifer is also an adjunct professor in the graduate social work program at Spring Arbor University. Please join me in welcoming Lindy and Jennifer.
Great, thank you so much, Krista. I think we'll go ahead and move to the next slide. And again, my name is Lindy Winsler. I'm with Memory Lane Care Services. So as we get started, I just have a couple more acknowledgements. And Krista, thanks so much for the overview of this grant through the Administration for Community Living. And we're so excited to be here with you all today. So I'd also like to acknowledge the State of Minnesota Act on Alzheimer's. So when we created this program, Act on Alzheimer's generously shared much of their training curriculum with us so that we could create this really wonderful program that we're able to share with you all today. So thanks for joining us, and we'll go ahead and move to the next slide. So I'm just going to read to you the learning objectives for today. So we have quite a bit of really great materials to share with you. So we're going to be looking at identifying different causes of dementia, understanding the importance of timely detection and effective tools to identify dementia, recognize common behaviors among people with dementia, learn methods for analyzing behaviors of persons with dementia. We're going to determine causes of challenging behaviors, apply interventions to reduce behavioral symptoms. We're going to implement systematic non-pharmacological approaches to manage behavioral symptoms, as well as at the end of today's program, we are going to be listing some resources and sharing with you some more information about the Benjamin Rose Institute on Aging Care Consultation Program. So we're excited for you to be here. So we'll go ahead and move to the next slide. Okay, we can move to the next slide. And I'll try to speak up. I know someone put in the chat that they're having a hard time hearing me. So if anyone else has any issues, then please let me know. But we'll go ahead and keep moving forward. Sorry about the technical difficulties, and we will go ahead and keep moving forward. So one of the things that we're going to do today is talk about a couple case studies just to kind of set the stage, and then we'll be looking as we carry on through the presentation at different tools and methods to kind of analyze some of these behaviors. And I think you'll see once I read this to you as well that this is really a common scenario that you as maybe a professional have heard from many different families. So this is just kind of setting the stage for today. And I'll go ahead and read this to you. So Jane Smith is 76 years old. She lives in the home of her daughter and the daughter's husband. The daughter and husband have 3 adult children living out of the house. The daughter has come to you with concerns that Jane is quick to take offense at almost any suggestion from the daughter. Jane resists taking showers, claiming she does not need a shower that day. There have been concerns when Jane has gone almost 2 weeks without bathing. Furthermore, when making suggestions to Jane, the mother often responds with belittling things about the daughter. You are fat, you are stupid, you never did have good sense. The daughter says she would like to keep her mother at home, but says she doesn't know how much longer she can go on in her caregiving role. A little bit more information is that the daughter says that she has been told that Jane has dementia, but she doesn't know if it's Alzheimer's disease or another cause of dementia. And she also knows that her mother takes a pill and a patch for Alzheimer's, as well as something for her blood pressure and sleep. So again, we'll look at a couple of these case studies, and if you just reflect back as we move forward when we're looking at interventions and tools, but I'm sure this story sounds familiar to many of you all. And we'll go to the next slide, and I'll give it to Jennifer.
Okay, thanks, Lindy. My name is Jennifer. I'm glad to be with you today and go into an overview of dementia now. And when we think about dementia, we often think of different signs and symptoms that we might see. Maybe the first thing that we think of is memory loss. It is important to kind of point out that memory loss is referring to short-term memory loss, as we know that long-term memories stay intact well into the disease of dementia. We often see confusion in individuals with dementia, the disorientation to time or place. They may get lost in familiar locations, and they may have changes in speech and language. And that might be a big clue when we're thinking about behavioral interventions, because behavior is a form of communication. And so when someone with dementia is having trouble communicating as they used to verbally with speech and language, they're going to try and show you if they're in pain or if they're hungry or bored, etc. And so these often are labeled behaviors when really the person is trying to communicate. So paying attention to any changes in speech and language and new behaviors, which is what we're going to talk about throughout this presentation, is really important. Other signs and symptoms that we might see are trouble with time or sequencing. A person may just think that they just showered yesterday when, like Lindy said, it's been a week or two. We might also see poor judgment or difficulty problem solving, any changes in sleep and appetite, mood, personality, and behavior changes in self-care and hygiene, difficulty performing familiar tasks. And one of the things that we want to point out is that these abilities may fluctuate. In fact, they could fluctuate day to day and even during times of the day. That can really confuse and frustrate caregivers, but it is the nature of the disease. And so knowing that can really help us to not feel frustrated and to be able to address behaviors better. And diminished insight is another sign and symptom that we want to draw attention to. So this would refer to the lack of abstract thinking. For example, being able to think ahead to what might happen if a person does this, so having that idea about consequences for our actions and, predicting what could happen is diminished in dementia. So we want to go to the next slide, please. So here we're going to define what is dementia. And so the definition usually is a decline in mental functioning, but this is a decline to the point that it interferes with daily activities and our social relationships. So it's much more severe than typical age-related difficulties, and it's going to interfere with daily living. So being forgetful might be, someone might be concerned that they're developing dementia, but forgetting to buy a loaf of bread at the store is much different than having a loaf of bread in your kitchen and not being able to remember or understand what we do with bread, what's its use. And so that's really the differentiation. We're talking about an interference in daily activities. Okay, next slide, please. So we have a slide here of causes of dementia. And so some different names of types of dementia are going to pop up under this umbrella here. There are actually over 80 kinds of dementia. This slide shows the most common types. And we know that Alzheimer's is the most common out of the types of dementia. About 60 to 80% of dementias that are diagnosed are Alzheimer's disease. There's also the incidence of mixed dementia. So a person could actually have 2 or more different types of dementia at the same time. When talking about behaviors, it's sometimes helpful to know the type of dementia, although not everyone always knows the type of dementia that they have. That might not always be diagnosed, but there's some symptoms that we might see that are more predominant in certain types of dementia. For example, Lewy body dementia typically shows more visual and auditory hallucinations. And so that would be expected if a person that you're working with or caregiving has Lewy body dementia, that you would see behaviors that relate to that, as opposed to frontotemporal lobe dementia, where we might see more changes in mood, personality, and judgment, because that's the part of the brain that's being impacted by that disease. And so the behaviors you might see may have more to do with disinhibition or decision making, kind of as we talked earlier. However, sometimes people are diagnosed with dementia, but not the specific type. Only about 40% of people who have dementia have a specific type of official diagnosis of the type of dementia. Okay, we'll go to the next slide. So we're talking about types of dementia and why it's important to have timely detection. Oh, Lindy, this is your part, isn't it? I'm sorry. Go ahead.
That's okay, no worries. Thank you, Jennifer. So I'm going to talk a little bit about why timely detection is important. So many of you might have asked this question yourself, or have had families ask you, why is it important to get a timely diagnosis of dementia? So I think there are a lot of positives that are highlighted on the screen of why it's a good idea to get a timely detection. Some of it can be future planning for that individual that's experiencing memory loss. So they can be more involved in their future care plan. By doing that, they can decrease some of the burden on the family members and friends who are helping them as far as what they want for their future care. It can also provide some independence as far as future planning and setting up services while they're able to be involved in their care plan as well. So on top of that, there is a really great reason why a detection of dementia is so important, and getting that diagnosis is because dementia can be a really big barrier to managing your other health conditions. So for example, I'm going to read to you a really quick kind of scenario that will give you kind of a better explanation. And this is another scenario that I'm sure that you all have frequently heard as well. All right, so an 80-year-old woman comes in for a routine doctor's visit. She has a medical history of diabetes. Her A1C is significantly elevated, suggesting that her diabetes is not well managed. When asked if she is checking her blood sugar and taking her insulin regularly, she replies, "Yes, I am." So she kind of offers that socially acceptable response. So the provider responds with increasing her insulin or adding medications to address the problem. But of course, that elephant in the room is that the patient is in fact not checking her blood sugar or dosing her insulin correctly because she has undiagnosed dementia and can't remember to do these things on a daily basis. so instead of removing that barrier and getting someone or getting some support to help her manage her medications, instead we're increasing that risk by changing or increasing medications. This can also lead to unnecessary utilization of healthcare. So whether that's hospitalization, obviously emergency room visits, and it could cause other problems later in the future. So these are some of the main reasons why it's so important to seek out a diagnosis of dementia. And we'll move to the next slide. So this is just highlighting some cognitive assessment tools. So there are literally hundreds of cognitive assessment tools that you can find online. So with that being said, it's always a good idea to consult a physician and seek out a professional diagnosis. And these are just some tools that we just want to let you know that are available, and I'll highlight a couple of them. So some of these, actually all the ones on the screen can be found online, and these are actually hyperlinks. So when you get the PowerPoint, you can visit the websites and take a look at some of these cognitive assessment tools. Some of them I'm sure you've heard of: the Mini-Cog, the MMSE, SLUMS, very well-known cognitive assessment tools. There's some other interesting ones. One of the ones highlighted on this screen is the SAGE. This is the self-administered neurocognitive exam. So you can actually print this out and do this with a pencil, piece of paper. And then what's recommended is that you take those results into your healthcare provider, and maybe if you want to let them know that you're finding that maybe the results you were surprised with, and maybe you feel like you're experiencing some difficulties with your cognitive functioning. Another one I'll highlight that maybe you have or have not heard of is the NTG early detection screen for dementia. So this tool is actually used for individuals with intellectual and developmental disabilities who are experiencing early signs of dementia or who are at risk for developing dementia. So that's another really great cognitive assessment screening tool as well. And we'll move to the next slide. So care and treatment. So for today's presentation, you're probably going to notice a theme. We're putting very little or less emphasis on medications, and we're looking at more psychosocial interventions. So we're going to be looking at the environment. We're going to be looking at more, person-centered care, or looking at the person and what's going on around them in their environment. Along with that, we're going to put emphasis on how important it is to support caregivers and caregiver education as well. So as professionals, it's not always the physician who's going to have access to all these resources. I think that in a perfect world, that they would be able to, connect each individual that maybe receives a diagnosis with all these resources that would be helpful to them. But sometimes it does come down to community resources and connecting those family with any local organization, and then you can kind of pick up where the physician might have left off. It's also important to note, maybe if you are working in a healthcare field or any field at all, that you refer individuals at any stage of the disease for any kind of dementia to any type of resource that will give the caregiver and individual support within your community. So that's extremely important as well. And we'll move to the next slide. So mood and behavioral symptoms. So this is the topic of the whole day. So I guess this will outline why we're talking about this topic. So we know that nearly all individuals with dementia will experience mood and behavioral symptoms during the course of their illness. And just here in a minute, we're going to talk about defining some of those behaviors so you can know exactly what we're talking about. But I think that this can be such an uncomfortable and challenging topic for care partners, caregivers, and even professionals who are working with someone with dementia, is that these mood and behavioral symptoms can be so challenging and difficult. And it notes here that up to 80% of nursing home residents have dementia. I think that kind of highlights some of the reasons why, they end up in long-term care, is because some of these mood and behavioral symptoms can be so challenging for caregivers. And another statistic is that up to 90% of individuals with developmental disabilities and a diagnosis of dementia will exhibit behavioral and psychological symptoms as well. So just why we're talking about this topic today. And we'll move to the next slide. And I'll give it back to Jennifer.
Okay, so we're going to talk about defining behaviors, and this is really important to help give us clues as to what's going on with an individual. And we really want to drive home that behaviors can have negative outcomes. I mean, we know that it can be challenging for the caregiver, but there's also some other negative outcomes that can come from unaddressed behaviors. So we know that decreased quality of life is one outcome from the behaviors. We know that behaviors can put people at increased risk. For example, maybe exposure to the elements. If you have an individual who's wandering, you could have complications due to falls. You could have increased mortality when individuals are needing to take psychotropic medications. And so these are all things that we try to improve the situation by addressing the behaviors that are behind whatever's going on. Increased length of stay in a hospital is another negative outcome. The system-wide cost going up from behaviors that are not addressed. Of course, increased caregiver distress and depression and burnout. And we know that there is a caregiver burden, and it's even higher when there's behaviors that are causing negative situations in the home or with those interactions. We see premature nursing home placement from unaddressed behaviors, and then the increased mortality. Next slide, please. So the next couple slides are going to go into some common dementia-related behaviors more specifically. And so this is a list on the screen of some common dementia-related behaviors. Some of those may seem, like things that you might have already thought of in your head. Repeating questions, maybe agitation, a person who is sleeping during the day and is awake at night, wandering and pacing, apathy, resisting care. We know that socially inappropriate behaviors refer to behaviors that may be okay in private, but not in public. And so this can happen when there's disinhibition. So you might see a person who's disrobing or has participating in masturbation. So those would be socially inappropriate behaviors that are commonly seen in a person with dementia. Aggression, delusions, and hallucinations. And sometimes you might see or be clued into something by a sudden change in behavior. So maybe it's a person who had previously been very pleasant and now is maybe very withdrawn and apathetic, or maybe it's the absence or reversal of a previous behavior. So someone who yelled out in the past and now is not doing that anymore. So really any change in behavior should be looked at more closely to kind of figure out what is the underlying cause and how can we address that. And next slide, please. So here we have a case study I'm going to read to you that can help us kind of apply some of these questions and ideas regarding behavior. So Tom Baker is 51 years old. He works part-time at the local grocery store and shares a group home with 4 other males ranging in age of 40 to 50 years old who also live with Down syndrome. Tom's father is 89 years old, serves as Tom's primary source of support, including guardianship, and lives in his own home in the same town as Tom. 1 adult sibling lives nearby, while 2 other adult siblings reside in neighboring states. The father comes to you with concerns of Tom's recent weight loss, refusal to talk and participate in usual activities, and he states that Tom is crying a lot. He tells you that Tom can't seem to remember how to do simple things around the house anymore, and on one recent occasion, he struck out at the group home manager. He's worried that if this continues much longer, Tom will not be able to remain in the group home that he's always loved. The father states he's concerned about his own health conditions and the added care responsibility this will likely place on his other 3 children. More information, the father says about a year ago, a doctor told him that Tom most likely has Alzheimer's. This was about the same time that his wife, Tom's mother, was diagnosed with cancer. Sadly, she died 1 month ago. Tom takes daily prescription medication for his thyroid and arthritis, and occasionally takes over-the-counter medications for heartburn and constipation. So we just got a lot of information about Tom. Looking at it from a distance, you might just be like, okay, this is a bad situation. He appears to be developing some dementia. Symptoms are increasing. But, when you take a closer look at everything that's going on, there's some changes in behavior. He's a recent weight loss, refusal to talk and participate. He's crying a lot. He can't seem to remember how to do simple things that he used to be able to do. And he's had an incident of aggression. So these are all things that appear to be changes in behavior, like we talked about, either the reversal of a previous behavior or a new behavior popping up. We also know that emotionally and socially, there's something significant that just happened. He just lost his mother after about a year-long battle with cancer. So, that cannot be overlooked. That should be addressed. And then this kind of vague comment that a year ago, a doctor told him that Tom most likely has Alzheimer's. What exactly does that mean? Was there an actual assessment done? Was he thoroughly evaluated for dementia? So some things to consider when we look at this case study, and into the next page, or the next slide, if you would, please. Okay, so here's some kind of general considerations to ask yourself when you're looking at behavior issues. So the first thing is to ask, is this behavior really a problem? And if it is a problem, who is it a problem for? Is it hurting anyone? Is it bothering or causing a problem for the caregiver, for the individual, both? In Tom's situation, it appears that his behaviors are causing concern for the group home manager, perhaps, for being lashed out at. The father's concerned, but Tom obviously is not doing well. There's things that we can see that are bothering him that we need to address. But sometimes we might have a situation where an individual keeps moving chairs around in a dining room, for example. And that might be annoying for a caregiver, but it's giving the person something to do. And as long as it's safe for the individual, we might need to really explore with the caregiver if the behavior is really a problem. So that's what we mean when we ask, is this behavior really a problem? Is this the mountain or the hill you want to die on, kind of thing? And then we also want to recognize that some behaviors are common. So it's helpful to have realistic expectations and to be educated and informed about maybe the progression of dementia and what behaviors you may see, so we can avoid arguing or rushing a person or correcting them if they are believing something. So we want to advise for all of us to take a deep breath, to slow down, step back. We want to simplify, we want to smile, we can redirect and reassure, and maybe even try again later. Something that I think about is, we don't want to take this whatever behaviors personally. The person that we're working with is not trying to give us a hard time, they're having a hard time. And so if we take that deep breath and step back, so we're not getting our buttons pushed, and kind of evaluate, is this behavior really a problem? Is this just an annoyance, but we can deal with it, it's not causing any harm? So these are some helpful kind of considerations. And next slide, please. Okay, so we're going to go into causes of challenging behaviors. And challenging behaviors can fall under 3 different categories. So we have physical health, environmental, and other. So we just want to talk about some factors that might each need to be addressed differently. And the factors and the causes are not necessarily mutually exclusive. You could have maybe some causes from multiple categories going on simultaneously. So physical health, any kind of medical situations that might be going on with the individual need to be addressed. So if there's an organic cause for challenging behavior, maybe the person's in pain. Maybe they have a urinary tract infection going on that hasn't been diagnosed. And those are, notorious for causing changes in mental status. Or maybe there's another underlying illness. Maybe there's a comorbid condition like Lindy mentioned with the diabetes earlier. Has that been evaluated? Is that being correctly reported? So a good physical evaluation of the person and ruling out any physical health or medical causes of challenging behavior should be first. Also, in the environment, we see a lot of challenging behavior if a person is in unfamiliar surroundings or they're uncomfortable in some manner. Maybe the place that they're in is kind of loud and chaotic, and it's just overly stimulating for them. Or maybe on the other end, maybe it's too boring and they're just really feeling understimulated. They don't have anything to do. Boredom is definitely something to evaluate for. Maybe there's other things going on in the environment, the lighting, there's some other simple things that you can do visually and even kind of rearranging furniture that makes it more comfortable, that can make it a more pleasing and successful environment for the individual. And then other can include communication, which we're talking about a lot. So are there communication difficulties? We've got a lot of tips on how to communicate well with a person with dementia. So are those tips being used? Are there unrealistic expectations, again, either on the part of caregivers, staff, for what this person should be able to do, or other things? Are there unmet needs? So that could relate to boredom, that could be other things that are being overlooked, even unintentionally. So really examining the situation. Are there task-related frustrations? Perhaps the person's being asked to do things or given tasks or activities to do that they're just struggling to do, and that can be very frustrating. And then emotional health. So what's going on? We just read the case study with Tom. He's grieving the loss of his mother. Is he getting the support that he needs to effectively process all of those feelings and emotions? There could be there could be grief from having to move out of a home into a supportive living environment. There could be many, many things going on with any of us at any given time. And emotional health definitely can be a cause of challenging behaviors. So we'll go on to the next slide, please. Okay. So unmet physical needs can cause behaviors. And the first three on the screen, I think should be our go-tos, right? So fatigue, being hungry or thirsty, or needing to use the bathroom. These are, just part of being human, and we get tired or hangry. Hunger and thirst are pretty easy to address most of the time, but sometimes they're overlooked. And so, and then whether the person needs to use the bathroom, remembers where the bathroom is, or have they been prompted for that? So, excuse me, those are, just easily addressed if needed, but sometimes they are overlooked when we see behaviors. Then discomfort. So maybe the person's experiencing some joint pain, maybe they're constipated, maybe their skin is rubbing against objects. So this might take a little bit more kind of investigation, but if the person is struggling to communicate verbally, they may be, moving around, kind of having some outbursts, or just kind of listless. So, looking into whether they are having some physical discomfort. We know that the brain changes throughout the course of dementia can lead to loss of self-control. They can also lead to hallucinations or delusions. So understanding that throughout the disease process can help us to not be surprised, or if we have these kinds of situations. We also need to be well-versed in understanding the side effects or interactions of medications. And we know that this is common, but sometimes that is also overlooked. And so, having that evaluated and ruling out if that could be a cause of behavior. And then impaired vision or hearing, which could lead to misinterpretation, or the person could struggle to hear what their caregiver is saying to them. Incorporating some of the communication techniques that we're going to talk about can help address that, but sometimes we might not know that the person's experiencing impaired vision or hearing until we get that assessed. So that is moving on for our next slide. Okay, so sometimes there's also environmental causes for behaviors, and some of the things that we can look at, again, sensory, whether the person is over or understimulated. So sometimes there's too much noise, so the person is just, it's too loud for auditory. What about activity level? Every one of us is different and has different preferences. So maybe the activity level is too high or too low, too many people or not enough people. Is it visually cluttered? So having just kind of a clean environment or setting is important. So sensory overload or sensory deprivation, thinking about kind of those two extremes and finding that sweet spot for the person. Thinking about changes in schedules or routines. So sometimes that can cause some agitation, some uncertainty. We like our routines, and so if there's been a recent change in schedule or setting, maybe starting at a new day program, maybe a new caregiver, this can cause some behavioral challenges. And so thinking about those ahead of time, stopping and rewinding to look at any environmental causes. Unfamiliar places, sudden movements or startling noises. So anytime that we experience something that we weren't expecting, that can kind of cause a surprise, a change in behavior. Feeling lost and overwhelmed in a large space. Sometimes, our abilities, if we have dementia, to kind of navigate and also discern where we're supposed to be can change. So maybe setting a smaller, cozier a portion or partitioning off a space can be more reassuring. And then lighting, like our environment, lamps and overhead lighting, and are there shadows, and how does that make the person feel? You can look up a lot of information on environmental interventions and modifications, and some of them are very simple to do in a setting that can help a person feel more safe and secure in that location. And then next slide, please. And then other causes of behaviors. So this is kind of a catch-all. So we may see a person who has some behaviors if their caregiver is not visible. So maybe there's kind of some insecurity there. If they're given instructions that are unclear or too complicated, so maybe too many words coming at them too fast, and so they're having difficulty processing those. If they're given an activity to do that feels too childlike, so they might kind of feel frustrated or patronized by that. If they need reassurance, you might see somebody who's repeatedly asking the same question, and that might seem very annoying. Maybe that's actually, there's an underlying need that they have to be reassured. If they experience a lack of social support, again, changes in routine, that could be the daytime routine, that could be, maybe the way that they come, they're transported, or who their caregiver is. Many different things could cause a change in routine. Being around people who don't understand dementia. Again, education is so important. That's why these types of trainings, and there's so many different resources online, and we'll talk about some of those later. So important. Many of us didn't know a lot about dementia before we started in this work. So also people working with caregivers or staff who don't tolerate the changes brought about by dementia. So again, understanding the disease process, what to be expected, if we know the type of dementia, what that route might look like for the person as far as their abilities and some of their challenges. And then people who don't accommodate the person's needs. So that's another potential cause for behaviors. And I'll pass it back over to Lindy.
All right, great. Thanks, Jennifer. So we're going to be looking at some interventions, and I guess these would be the stepping stones or the starting blocks of some interventions. And then later on today, we're going to talk about some more standardized tools that you can use. But before you do anything, we kind of want to look at some of these things. I think at one point in our lives, we've all, I guess in some way analyze something and looking at, who, what, when, where, why. And then Jennifer mentioned earlier with her case study about Tom, has anything recently changed? So before you're looking at any type of medication, or if something, let's say one of those defined behaviors are happening day after day after day, this might be a really great starting block. So a lot of times I recommend to people to start a behavior log. And that could be, I think there's some things out on the internet that you can, maybe print something off that says, maybe these who, what, when, where, and why, and things like that are, but, maybe just starting a kind of a journal or a log as far as when is this behavior happening, who's around, and we'll kind of go into more detail about how to log these and keep track of these. But I think, just an example, I guess, of what this might look like. I think we want to look at, let's say, for example, the behavior of repeating. So if it's a certain time of day and someone's repeating something over and over again, I think we hear a lot sometimes, I want to go home. That could be one example. I know there's a individual who attends the adult day center that I work at. And I think without fail, whenever this person attends their center, at the end of the day, and we could probably get it down to a science if the staff, started a behavior log, but this individual asks, "Where's my dog, Darby?" And it's right at the end of the day, probably when folks are leaving our day center or kind of maybe getting a little anxious, and what is she trying to communicate? And I think that it's, her expressing some anxiety. So it's not, answering the question. It's, how can we redirect this person, and what is she communicating by saying this phrase over and over again? So I think that's when we look at, to keep in mind that behavior is communication, as Jennifer mentioned, and we kind of repeat this throughout the whole presentation. So bear with us. But so what are they trying to express? Is it loneliness? Is it anxiety? When they're repeating questions or expressing some sort of behavior. And then on the other hand, with that, you want to look at our communication back to that person and how that impacts their behavior. So back to the dog, Darby, I think if one of our staff or myself said, I don't know your dog, or, maybe had a negative response or said, I don't know where your dog is, that could maybe cause a lot of frustration, anxiety, maybe some fear. To the situation. So you have to keep in mind that the way that you communicate back to the person can impact the whole situation. And that's why, again, we're doing trainings like we are today with behavioral interventions to kind of educate professionals and caregivers on what communication tips might be helpful and alleviate some of this strain and stress as well. So we'll move to the next slide. Okay, so kind of along the lines of this behavior log or this journal that you're keeping to try to identify what are some of these behaviors and define them. So many people have many different ways of describing things, as you all know, but it's really, really important before you maybe pick a tool or pick a starting place of how to reduce this behavioral symptom. You want to make sure you're able to define it and, maybe be mindful and think about what exactly is happening. I think caregivers, they're so, have so much on their plates, and it's hard for them sometimes to even identify, like when I'm talking to caregivers on the telephone, if they're telling me, I'm just so frustrated and they're just really difficult. And that's when I kind of break it down to them, well, what is difficult? You know, what is happening? So I think that's when you need to kind of define the behavior. So is it attention seeking? Is it some sort of verbal outburst? Is it aggression during care? So maybe it's a personal care task that you're helping them with. I think we see that a lot sometimes with toileting as well as with bathing. It could be an actual physical behavior that they might be hitting or pushing or kicking you. It could be a sexual disinhibition. It could be restless movements such as pacing or rocking, or maybe it's walking about or wandering, as well as calling out. So you want to make sure you're able to define the behavior to kind of address some of these concerns. And we'll move to the next slide. All right, so after defining the behavior, you want to place this symptom in a certain category. So we have these three categories. We have mood symptoms. Is it a psychosis? Is it aggression? So we kind of already talked about, mood changes or personality changes, but what exactly is it? Is it a type of agitation or anxiety? Is the person just feeling down or unhappy? Is it some type of, depression? Could it be irritability, or could it be a mood swings? And then you could look at, is it a delusion or hallucination? And if possible, could that psychosis be helped with some sort of medication that could reduce that symptom? And then you have aggression, so it might be some impulse control as well. And we'll move to the next slide. So the next few slides, I'm going to talk about identifying reversible causes to the behavior or the behavioral symptom. So this is another great starting place. So again, we talked about putting less emphasis on medication for today's training. So again, before immediately jumping to some sort of medication treatment for this really difficult behavior, we want to consider what are some common reversible causes of this agitation, the behavior, or any type of behavioral symptoms. So you can look at, is it a delirium? Is it an untreated UTI, as Jennifer mentioned earlier? Is this person on a new medication, or maybe is having an interaction with another medication? So making sure that, maybe talking to your doctor about medications and how they're interacting would be another great starting place. And then maybe addressing some of those environmental triggers and in removing some of those, as Jennifer mentioned, some of those maybe a sensory overload. So maybe addressing some of those and then reevaluating and see if that behavior is still occurring after addressing some of these things that can be modified before medication. On the right-hand side here, you want to make sure that that if there's an undiagnosed psychiatric illness, or maybe there's a mental illness that's not being treated, that could be another cause. That if that's being treated and they're on the right medication and managing that correctly, then that could be a reversible cause. Back to caregiver education. So after maybe some education is given to the caregivers, could that be a reversible cause of this behavioral symptom? So maybe it's just the communication or understanding the dementia, or maybe just letting some things slide. I think that's one thing we're going to continue to stress is this really a problem? As long as everyone's safe, then maybe it's okay. And then we talk about along the same line with that, the unrealistic expectations that caregivers might have. Rather they expect them to be able to do everything that they once did, whether that's their self-care, or maybe, sometimes we see, they used to help out around the house and clean up after themselves and do the dishes. Now they can't do that anymore. And you kind of have to take a step back and see how, their memory loss has affected them. And if that's not a realistic expectation anymore, then that's a conversation that you can have with the caregiver as well. So we'll move to the next slide. So more reversible causes. So you want to identify what you feel the root causes of this behavior. So again, we've talked a lot about anxiety or fear or uncertainty, which I think can be so common. I mean, if you can imagine or picture how you would feel if you're having, this piece of yourself that's you feel like it's missing, and how, scary that must be. Maybe just to not be able to remember, not to be able to remember, where you are or how you got there. I think sometimes we see that in our adult day center, but how scary that can be. But another thing, and when I was looking over these slides, I was just like, this is interesting. When we're looking at touch or invasion of personal space, I think we always try to get a better background and understanding who this person is as a whole. And that goes along the lines of what their personal preferences are. I think I like to think of some people who might really enjoy if someone comes up to them and maybe gives them a shoulder rub. Like they'd be like, oh, this is great. And other people, that is something that they cannot stand. So there's people that are okay with that invasion of personal space, and there's other people that that's not something that they ever liked in their life. So just being cognizant of what people's personal preferences are is a really great rule of thumb. As you know, just the lack of choice that sometimes happens over time with people with memory loss, I think slowly sometimes that kind of gets taken away from them, unfortunately. So I think if there is a way that you can continue to have them remain as independent as possible within the realm of thinking of safety, then that's so important to just give them meaning and purpose as well. So, and I think that another thing to look at would be pain or fear of pain. So making sure that if they have arthritis or, I think that it's such a big issue is that as dementia progresses, in certain cases, that they're no longer able to verbally tell you, hey, my knee's in a lot of pain, and maybe it's using some other cues, some nonverbal cues, maybe rubbing their knee or their foot or that case. So just being aware of if they are in pain, how might you be able to help them, maybe with some regular Tylenol or something to help with that pain. And of course, seeking or consulting a physician as well. And we'll move to the next slide. All right, so more reversible causes. So you want to look at those unmet needs. So Jennifer talked about this as well, but I think just making sure that whatever they're doing, whatever their daily activity or routine is it's giving them meaning and purpose. And I think it's not meaning and purpose. What means to you would be meaningful and purposeful. It's what does it mean to them? So I'm going to talk about, I think, coming up here about some activity planning, and I know Jennifer's going to, I believe, talk about that too. But what's important to them and what's meaningful to them. So looking at their past professions and hobbies and things like that. So we talked a little bit about environment and over and under stimulation. I think I just can think of so many examples throughout this whole presentation. I'm sure you guys are doing the same thing, but I think of one caregiver who once told me that, and this goes along with overstimulation. So she said, I give him his iPad and it has his games on it. I also turn on his favorite TV show. And then I also set his crossword puzzle in his lap. And for some reason, he's really frustrated and he doesn't know what to do. And they really just being in the moment of a caregiver, this person really just didn't know what the issue was. So we had to really break that down and say, let's try one thing at a time. Or, is this the care receiver able to use the iPad anymore, and figure out, what do I do on this and what game am I playing? I mean, I can imagine that would be frustrating for everyone if they're given, 5 activities to do at once. So just an example of that. So I think with finding activities and purpose and things like that, I think as long as safety is not an issue, then you can kind of let things slide, as I mentioned earlier. So is this behavior really a problem? Is it hurting anyone? And if it's not, then it's okay. I think an example, when I was with you all last time, was that a caregiver was really frustrated that their loved one kept unrolling the toilet paper, and that was really enjoyable for them and fun. I think another example might be, I know there's an example I remember of a care receiver who was moving the chairs all around and kind of rearranging some of the furniture that they were able to in the house. And that was, meaningful and purposeful to them, and giving them an activity too. And just talking with the caregivers about, is this really a problem? As long as safety is not a concern, then that's okay. So, And then again with caregivers, so just limited knowledge about the disease process or behaviors can be an issue. Back to the caregiver who might have been really upset about the unrolling of the toilet paper, and we're thinking, that's good, let them do that, and as long as they're happy, and if there is something else you can find for them to do that's enjoyable, that's good too. But we'll move to the next slide. Okay. So more interventions. So we're back to the who, what, when, where, why. So this just gives you a little more detail about how you can think like a detective and ask these questions before even moving on to one of the behavioral interventions tools. So you want to look at who's involved and present when this behavior occurs. Maybe it's someone who's, yelling out. What exactly? So we talk about defining that behavior and being very specific. So when does this happen? Is it only in the morning? Is it the late afternoon? Is it at the evening time? So just again, so many examples. Maybe it's someone who's having an issue with, bathing their loved one and looking at, well, what time did they bathe in the past? Or, how can you fit in with their routine and maybe modify some things to make this not an issue? So again, where does this happen? Is this behavior occurring at a specific place in the house, or maybe it's in the car, or where is this happening? And then you want to look at why. So what happens right before this behavior, and then what happens right after? And then I think a really great key to this too is asking the person who knows them the best what they think the cause of this is. So I think whether maybe you're a professional working in in-home care, or you're the family member and you're trying to work in a team or a network with maybe even other family members to help take care of someone. Maybe, working as a team to identify, what do you think the problem is here? What's the cause of this? Because you might be able to get some really great feedback and insight from other people. Again, we're back to, has anything recently changed, whether that's medication or a significant life change. Maybe it's something that this person just moved and you're wondering why this behavior is occurring. I think any of those significant life changes can be a cause of these behaviors. And we'll move to the next slide. So we look at another kind of stepping stone for some of these interventions. So one of the things we like to teach family caregivers is to validate, join, and distract. Sometimes we use the word redirect rather than distract, but I think with that too, if you've ever heard the phrase, just join their reality with someone who's living with dementia, that's really what we mean here. And I'll give a quick example that I think is so helpful on how you can validate, join, and distract. So George lost his wallet and has been searching for a while. George hasn't actually had possession of his wallet for over about a year now. So what you want to do is validate George and let him know that you understand how frustrating it is that he can't find his wallet, and how frustrating it is when you lose things, and just validate George's feelings. So then you want to join George's reality and help him look for his wallet. So while he rummages around, you can redirect George by picking up maybe a photo album or something that maybe he enjoys doing, and reminisce with him about the photo. So this is just a really great example of how you can be on the same side as someone with dementia. And you don't have to be correcting them or arguing with them and saying, you haven't had your wallet. I think, what this presentation is really about is just these simple tips that will make such a big difference in so many people's lives. So I hope you think so too. But so again, we're back to asking yourselves, is this really a problem? Who is it for? So just some things to consider when caring for someone with dementia. So we'll move on to the next slide. So I'll briefly talk about activity planning, some communication tips, and then some importance of caregiver support. So a little bit more about activity planning. So just to make sure you're tapping into the capabilities, the hobbies, the previous interests of people that will give them a meaningful and purposeful life. So I think it's a really great idea to look at what this person did in their past occupations or professions. I think we've had people, attend our center with all different types of backgrounds and professions. And I know there's been a couple times where people have had, different careers, or maybe it was working in, financing, which I know nothing about. But I think what ended up happening is, we'd give them pieces of paper that they could look through and file, or give them envelopes and things like that. Anything that will give them meaning and purpose. And then what's really great is involving repetitive motion into this activity. So this will give them, kind of that sense of normalcy, and they're able to feel accomplished when they're able to use this repetitive motion and complete a task, or something that's meaningful to them. So there's a whole slide coming up on communication, but just to talk about that, and the importance of that is to remember to slow down, really offer, one choice at a time would probably be preferable when communicating. So just one option at a time. It's okay to help individuals find their words. I think there can be a change within speech and language and their ability to verbally communicate. And this is, everyone's different with different causes of dementia, but it's okay to help them find their words. I'm sure they'll thank you if they're struggling to find a word and they're, pointing to their purse or something like that. You'd say, oh, you want your purse. And it's okay to help them with that as far as communication goes. A little bit more on environment, as Jennifer mentioned, we want to remove clutter, minimize those distractions, and then encourage caregiver support as much as possible. So encouraging practicing self-care and coping skills. And I already mentioned a little bit about this, but minimizing that confrontation. So we actually say at my organization, do not argue at all whatsoever. You want to be on the same side and not reason with the person who has memory loss or cognitive impairment as well. So we'll move to the next slide, and I'll give it back to you, Jennifer.
Okay, thank you. So we are focusing this presentation on non-pharmacological interventions, but we do just want to touch base on this slide briefly that pharmacological interventions can be effective at times, but they should be pursued only after psychosocial interventions have been tried. So these other things that we have talked about, ruling out, changing environment, routines and communication, all of those things. Most pharmacological interventions are intended for short periods of time, and they have to be regularly monitored. So really using a combined approach is best for the individual. There are some different dementia medications, as well as antidepressants and antipsychotics that are sometimes prescribed for people with dementia. And these should always be discussed with the healthcare provider. There's also a field of study called pharmacogenomics that is really looking at the person's DNA, their genome, and helping to use that information to decide which prescription medications would be best for this person. It studies how genes affect a person's response to drugs. It is a relatively new field. It has a lot of promising, interventions coming out of it to make effective, safe medications tailored to the person's genetic makeup. And it is kind of still in the experimental stage, and a lot of research going on. But we want to, again, employ pharmaceuticals after other psychosocial interventions have been tried. We know that dementia medications typically have side effects that involve the gastrointestinal system. Sometimes they cause weight loss, diarrhea, vivid dreams, and vertigo. And we know that individuals with dementia already have a lot going on. So bringing on new side effects from pharmaceuticals really needs to be evaluated, whether they're needed, and balancing out, the benefit. Antipsychotics are sometimes prescribed. They also can have side effects like constipation and maybe sedating the person too much. So just to touch on, it is a kind of weighing the benefit for the person, and should always, of course, be a discussion with healthcare providers. So we'll go to the next slide, and we're going to look at some different behavioral intervention tools as we continue looking at interventions. And there are many options. We're going to look at a few examples. They all have some common similarities. They're going to look at what is the behavior, what are possible causes, what can be done about it, and then choosing an action to take, and then evaluating whether that worked. So we're going to highlight those approaches as some of these. So the first one that we're looking at is the DICE. So DICE is one methodology for an intervention tool. And it's, the acronym. So D stands for describing and defining the behavior. So we need to know exactly what's going on. I love Lindy's example earlier of keeping a behavior log, so we know exactly what we're looking at. What is the target symptom? What is it? Aggression? Is it, whatever, withdrawal, crying out, whatever. So let's define and describe that behavior so we know what is our target. Let's investigate. So are there reversible causes? Are there times that this isn't happening? Is everyone safe? That's very important, right? Is this causing any safety concerns? So really investigating, having that curiosity to evaluate what's going on. And then step 3 is the C in DICE, create a treatment plan. So again, we're looking at non-pharmacological interventions. So are there things that we can do environmentally, relationally, activity planning that seem to be improving the situation, and then pharmacological if needed, and then evaluating. So the E for evaluate, after you've kind of gone through the treatment plan and implemented it, evaluate it. Did it work? Does it need to be tweaked? So DICE is one of the approaches for managing behavioral symptoms. And we'll go to the next slide, please. Another strategy is called IDEA. So again, this is, going through the letters in IDEA. This is an approach to help you figure out why a behavior is happening, what can you do about it. So ID stands for identify the behavior. Again, we want to know what is it? What's that behavior that's being, causing a difficulty specifically? And can you see it? Is it bothering others? When is it happening? And who's around when it occurs? So maybe you've got an individual, and maybe it's like a personality thing. When a certain caregiver or staff member is around, they're doing great, and maybe they're, it's specifically at on this person's shift or at this time of day or whatever. We need to identify the behavior and when it's going on. Okay, next slide, please. The E in IDEA stands for explore. So we're going to explore what is causing the behavior. We're going to understand the cause of the behavior. So again, health. Are we evaluating the person's health? Are they taking new med? Are they sick? Are they in pain? The environment, again, sensory stuff, so important. Is it too noisy, too hot, unfamiliar? The task, are they doing something that's too hard for them? Are they given something that they enjoy? What's the activity or the task? Communication, are they able to understand what you're saying? Are they struggling to communicate back? And then understanding the meaning of the behavior to the person. So is the person feeling confused, scared, nervous, unhappy, or bored? Maybe they feel patronized. They feel like they're being treated like a child. Are there things that remind the person of something that they used to do when they were younger, like go to work or pick up children from school? Like Lindy said, that can be a really good clue, if this was a past pleasant activity or familiar activity, and kind of incorporating that. So exploring is the E, and we'll move on to the next slide, please. And then A, adjust. So adjust what can be done. You are the one who will need to change. The person cannot. So what can we do? We're going to try different things. We're going to pay attention to the person's feelings. We're going to practice being calm, gentle, and reassuring. We are going to address what's causing the behavior. So we will have identified and explored that. We're going to keep tasks and activities simple, keep the home as calm as possible, or the setting, whatever it is. Speak slowly and gently, try not to say too much at once. And we're going to talk about that a little bit more in communication. But sometimes we may be rambling on and on. We want to try and keep things slow, speak slowly, and keep things simple. We don't want to argue, like Lindy said, we're not going to argue with people. We're going to agree, we're going to comfort and join with the person, whether they're right or wrong. And we're going to find meaningful, simple activities so the person isn't bored. So that's the A. And then the next slide, the A can also stand for accept. So sometimes there's not an adjustment. Maybe we just need to accept. So distracting or redirecting can include offering something they like to eat, watching a TV show, or listening to music that they enjoy, asking for their help with a simple activity, leading them to a different room, and then accepting the behaviors. Some behaviors you may need to accept rather than change. Maybe the person is not able to change or unwilling to. And so if there's not safety concerns and it doesn't bother the person, then maybe we just need to find a way to live with it. So that's accepting. And then one more tool is the ABC tool created by Linda Terry at the University of Washington. So this method can be helpful when addressing behaviors as well. It can be applied to different case difficulties. So the A is the activator. So we want to look at what happened just before B, the behavior. So sometimes it's called the antecedent, but the activator, what happened first, and then the behavior that's in a concern. What was the person with dementia doing? Who was present? Again, we're looking at the kind of assessing the who, what, when, where, when was it happening? And then the consequence, what happened just after B. So it's usually, what the problem was. The B part is easy to identify and then go back. What happened right before that? Was it shift change? Was it a meal time? Was there, were we asking them to participate in an activity and maybe they just didn't like that? And then the C, consequence, what happened after B. And then across on the other side, how are we addressing it? Change the A, change your approach, change the environment. B, change the B, what do you want the person with dementia to do? And then C, what will you do when this happens? What will you do if that doesn't happen? So just another way to kind of analyze the situation to try and address behaviors that are challenging. Okay, we'll go on to the next slide. We've got another case study. So in this case study, we have Helen. Helen Rogers is 83 years old. She lives with her daughter who moved from out of state to take care of her mother in the mother's house. Daughter has come to you with concerns that mother is constantly moving around the house, rummaging through her belongings. She empties out her closet and drawers, folding and refolding the clothes. She gets up on a step stool to empty out the kitchen cupboards, washes the shelves, and puts the items back. More information, Helen was diagnosed with an unnamed dementia 7 years ago. The daughter moved home after receiving reports of her mother leaving the house at nighttime, knocking on neighbors' doors. She was also underweight from poor nutrition, and the doctor said the mother's health was suffering from not taking her medications appropriately. So in this situation, if we're looking at using some of the tools, we want to identify, are these behaviors that are being reported a problem? Yes or no? And if they are a problem, who are they a problem for? So we've got Helen and some of her activities, and then we have the daughter. And so some of her behaviors, there's some safety concerns. She is getting up on a step stool. Is that safe for her? I don't know. We need to find out more. She was leaving the house at nighttime. She's underweight from poor nutrition. She hasn't been taking her medications appropriately. So there are some concerns. And then the daughter has some concerns. She's seeing her mother constantly moving around and rummaging through things and moving items, folding and refolding. So is that a problem? Is that something that needs to be addressed, or is that something that daughter needs to kind of come to terms with? And then, defining the problem behavior, what are possible causes? So maybe Helen is bored. Maybe Helen worked for years in a department store and she's used to folding and refolding clothes. And this is something that gives her meaning and purpose. Is this something that is a concern? Maybe the step stool part of it is, but maybe these other, rummaging and emptying out closets, is that really something that needs to be stopped? So having these kinds of, conversations, identifying what is a problem and what is not. What's the history of the interactions between Helen and the daughter? Are there opportunities for other outside help? Explore the effects on the daughter's emotional and physical health as a caregiver. Look at what the strengths are of the situation. And, think of, are there remote technology options to help with maybe helping the mother take her medications, using sensors or alarms on doors? I don't know, all kinds of things can be kind of evaluated when you have these case studies or these scenarios that you deal with in real life. And so using these intervention tools to kind of break it down and evaluate, implement an action plan, and then tweak as needed can be very helpful. Okay, we'll go to the next slide. So whatever we're doing, we want to focus on the person's remaining strengths, identifying those. It's really easy when the person has been diagnosed with dementia to focus on what they can't do, what they're struggling with, but we need to also maximize the abilities. What can they do? What are their remaining strengths? Whether those are social skills, their motor memory, what about their spirituality? What about talents and interests and abilities? And maybe those are things that have been with them throughout their lives, and maybe they're on a different level now, but they're still able to have those remaining strengths. Identifying and treating coexisting conditions. Most people with dementia have multiple coexisting chronic health conditions that can exacerbate dementia symptoms. And so making sure that those are being managed, and then offer strategies to reduce behavioral symptoms. And we'll go to the next slide. So activity planning, we've talked a little bit about this, but we want to just go through these bullet points. Meaningful and engaging activities are so important. So we can get ideas from that, from the person's past work or their leisure activities. Of course, making sure the task is appropriate, not too complicated. Reminiscence activities are very popular and helpful. Engaging with music, simple crafts and hobbies. We're looking for, not for perfection. We just want something that's pleasing, that they're going to enjoy, and that connects with, a sense of what's meaningful for them. And next slide, please. Communication. Just treating the person with dignity and respect. Don't talk about them or in front of them as if they're not there. Body language and tone of voice is so important. Not arguing. Using a rule of 7. I think there's another column of bullet points there if you want to click one more time on the slide. So giving some time in between what you say, maybe counting to 7, in your head after you ask a question so the person can respond, maybe waiting longer than 7 seconds. And then using short sentences of 7 words or less. Using visual cues to point to something if the person's struggling with the word. Crouching down or sitting down at the person's eye level. If they're seated, we don't want to stand over them. That can kind of feel uncomfortable or maybe a little intimidating. And so just using these really good body language and communication strategies to try and be patient and let the person communicate to the best of their abilities. And then the next slide, please. So simplifying the environment. We want to create small, intimate spaces, provide regular routines, maintain consistent staffing, choose appropriate lighting, reduce distractions, and then minimize clutter. So these are kind of just some cues and helpful tips for environmental interventions for behavior. And I will pass it back over to Lindy.
All right, we can move to the next slide. I time always flies. So I'm just going to talk a little bit about some resources and I'll kind of zip through this, but this is such an important piece of this whole presentation, is just making sure that you all are connected with some online resources as well as some things you can share with others. So just really quickly, to reiterate what we've talked about this whole presentation, the importance of having caregivers seek out respite, whether that's, looking at services for adult day or even a respite stay in a long-term care facility, in-home care, just encouraging caregivers to seek out that respite care to support their own health is so important. I know we're going to talk a little bit about the Benjamin Rose Institute on Aging care consultation program. I deliver this program in the greater Toledo area, and it's been such a huge help to so many families. So I'm excited for you all to learn about that program as well. As professionals, we can really encourage caregivers to accept help and make sure if you're able to, if that fits into your role, make the referral or call yourself if necessary. I think we all see a lot of caregivers, especially today, that if just one more thing's on their plate, it's just one thing that's too much. So just doing anything you kind of help them can be really helpful for support. So we'll go to the next slide. You can skip through, there's a couple. Yep. And so, go back. Sorry. So you want to make sure you're alert of different signs of burnout, depression, neglected self-care for caregivers, and then abuse for older adults when you're looking at that burnout, or if people are not accepting help or seeking services. And these can be some signs that you want to be aware of that could occur. Again, promoting respite services, support groups. There's so many online resources these days, support groups and things like that are available. So to be aware and maybe familiarize yourself with those as well. So we'll go to the next slide. So there are two sets of organizations I'm going to talk about that have some really wonderful tip sheets. So the first one I'm going to highlight is through Alzheimer's Los Angeles. So they have these one-page tip sheets that you can look at online or email to people, or you can print them out. And then on the back side is Spanish. And there's really great tip sheets. I know someone put in the Q&A that they had questions about sundowning, and I had a feeling we weren't going to be able to get to all the questions. So I threw in the Q&A. There's a tip sheet on sundowning. We'll go to the next slide that highlights many of the different Alzheimer's Los Angeles caregivership tip sheet topics. And there's also some, I believe, added to this list, so you'll have to check it out. You can search them online and you'll get this PowerPoint as well. You can click the links. We'll move to the next slide. So another great resource to highlight is the Ohio Council for Cognitive Health. They have some really wonderful tip sheets. They're a little bit more detailed, but can be so helpful for professionals, family caregivers, anyone looking to expand their knowledge about dementia. They have some really great ones on communication, understanding responsive behaviors related to dementia. So a lot of what we talked about today. And then they have many other specific topics, such as about, wandering or walking about as well. And we'll move to the next slide. So the next three slides are just some books. So just some guidebooks that are really great that I highly recommend you check out if you're looking for a guidebook for yourself, or if you're just looking for resources that you can share with family caregivers. So this one's Coping with Behavior Change in Dementia. This one's written by Beth Spencer and Lori White. And I believe all these books can be found on Amazon, so you'll have to check those out. And we can, yep, thank you. So this one's written by Coach Broyles. He was a football coach at the University of Arkansas. He was a caregiver for his wife who had Alzheimer's disease. So this one's kind of written in a male perspective. Again, a really great book. We'll go to the next one. And this is on the Alzheimer's Action Plan. This is everything A through Z for dementia, for Alzheimer's, another really great guidebook as well. And then we'll go to the next slide. So these are the next three slides. Once you get this PowerPoint, you can check them out. So it's on actonalz.org. This is through the state of Minnesota. And we can kind of skip through these next three, but they provide some tables and some screening tools that are a little bit more in depth for non-pharmacological strategies for managing behavioral symptoms. So again, some really great resources for you all. I hope you enjoy them. I think that's my last slide. And again, thank you so much.
And we are running a little bit tight on time, so I want to go straight into our slides about BRI care consultation. If we have a minute or two at the end, I'm happy to take a couple questions. And Lindy and Jennifer, if you'd like to type answers to those questions in the Q&A, that would be fabulous. Thank you. Thank you, Lindy and Jennifer, for your presentation. Before we conclude today's webinar, Project Director Branka Pramatica is going to tell you briefly about BRI Care Consultation, a care coaching program available for families impacted by dementia in Cuyahoga, Athens, and Washington counties. We recently expanded those counties, which will be on the next slide, in Ohio through the Administration for Community Living Project. Branka?
Hello, everybody, and thank you again for attending this presentation today. As Krista said, I'm going to share information about BRI Care Consultation, which is available across the country in several organizations, but I'm going to hone in and focus on the counties that are served through this ACL project. And hold on one second, get that slide back up there. So this is a telephone and email-based care coaching program that assists and supports adults at risk for developing dementia. It includes individuals with IDD and their family and friend caregivers or other supports. And within the service counties, it's available at no cost and it's generously funded by ACL. Next slide, please. Just very quickly, a personal care consultant can help in a variety of ways, finding, getting connected to health and community services, prioritizing concerns, communicating with family and friends, staying in touch with families to adjust the action plan as situations change, and also helps get other families involved in being an emotional support. Next slide, please. So this, as a part of this ACL project, as you can see, the service counties are Cuyahoga, Lake, Cuyahoga, Lorain, Medina counties in Ohio, as well as Washington County and Wisdom Pleasant in West Virginia, and Athens County in Ohio. And as I stated before, I know there are attendees from all over the country attending this session. If you contact the presenters or myself, I will be able to give you information about other organizations that deliver this program throughout the country. Thank you, and back to you, Krista. I think we might have some time for questions.
We do. We have 1 minute. One question that has been asked quite a few times, Lindy and Jennifer, is if you provide this training for different organizations, other states, if attendees are able to share those slides with, say, the facility of their parents. Could you talk a little bit about that, please?
Glad to talk a little bit about that. That's a wonderful question. I'm happy that you all have enjoyed today's presentation. So we are delivering this program as a part of a couple of grants to the Administration for Community Living. We are offering this in the greater Toledo area, and then you're attending today this educational series through the Urban Rural Grant through the Benjamin Rose Institute on Aging. So I think there's going to be some more opportunities for us to present this in the future. Just because we are working on a grant and we have a limited staff right now, we're not able to go to all facilities and locations. But I think if you were to reach out to one of us, either today's, Jennifer or I, or someone from the Benjamin Rose, we might be able to either connect you with an upcoming training that might be virtual, or see how we can help you. If we can deliver this program, we will try our best. So we appreciate the feedback.
And there will also be a recording available on benjaminrose.com. We'll be emailing it out to all registrants, the recording of today's presentation, if you'd like to share that with any colleagues or other folks that would be interested in it. We are at time, so thank you everyone for attending today's presentation, Behavioral Interventions when Caring for Someone with Dementia. A recording of today's session will be made available on the event registration page and in our resource library. We will be offering more webinars like this for our community organizations and families impacted by dementia each project quarter. This specific training will be available again. We're going to do it one more time next year. We're in our second project year, and we'll have another one for the third project year. To stay up to date on dates and topics for these upcoming webinars, please visit our website, www.benrose.org. In the chat, you'll see a link to a post-session questionnaire. If you could please fill it out, it helps us to improve our sessions and improve the services for persons with dementia living in Ohio. You will also be receiving that link via email later today. We ask that you please complete this post-session questionnaire within 1 week following today's sessions. Your responses and feedback will be used to show the impact of our programs. Thank you again for joining us and have a great rest of your day.